I think the thing that patients are most surprised to learn about me is that I had a sleeve gastrectomy myself after battling weight most of my life. At the time I had the sleeve, the real choice was between band, sleeve, and bypass. For me, diabetes would have compelled me to have a bypass. Today, I think duodenal switch actually fills that role a little better, although I still think bypass is a great tool. Outside of medicine, I really like to get outdoors as often as possible. Because of schedule, I usually end up doing individual things like mountain biking or hiking. I have a couple of kind of weird things I do with snow kiting and water kiting, which is kind of like windsurfing, except with a different attachment. And it's a real lot of fun, especially as you get older and don't want to fall down on concrete. I actually named my blog Bonus Life because when I lost my weight, I really did feel like I was getting a second chance to do those things in a way that I hadn't been able to do them in years. I still went snowboarding before, but I couldn't buckle my boots very well. I couldn't even think about the idea of getting into a wetsuit, and I really just didn't want to go out in swimming trunk kind of thing. So it really has given me a bonus shot at life. I'm really excited about the outdoor opportunities in Utah. I love my work and my partners, but I'm really glad that they're here in Utah so we can go outside and play so easily, and every season there's just something to do all the time. I was always interested in medicine, but really the pre-med track was not for me in college. But then after college I worked as an orderly, and it really pulled me back in for the care. That meeting patients, working with people, using my hands and my heart really made me compelled to go forward. I've known Dr. Cottom for over a decade, and he was part of the team that I trained with. I've known Dr. Richards almost as long, and I've always really wanted to work with both of them. I always tell my fellow surgeons in the OR how lucky we are that our patients are really the only ones who are actually excited to be in the hospital that day. I see a lot of patients who beat themselves up with that expectation that they have to be perfect in order to be healthy. After a while, this cannot be your whole life. It has to just be a part of your life, and you need to give yourself room to be good without being perfect. A lot of that is stress management and getting good rest and getting regular exercise, all parts of a reasonable life. But you've got to live your life, and we have to make things fit and work for you and listen to your body, listen to your needs. I think the most exciting thing for me is working with patients and helping them have an effective tool where they thought they had a problem that was virtually untreatable.